Dr. Terrazas. My project is aiming an A grade. And let me tell you a little bit about the project. Is a group therapy for former foster youth who are dealing with PTSD. And the characteristics of the group members are that they were experiencing homelessness and they were screened and referred to this group therapy. So they were just accepted into TLP. TLP is a transitional living program, and the setting for this group is a TLP facility. I work with my classmates Monica, Trisha, Erica, and Jackie, and their roles are among 18 to 20 years old. I decided to work with one of the most challenging phases for me, which is the beginning stage. And hopefully you will see the beginning, middle, and end phases in this project. I also had different sections for this project, which are the beginning, including introduction and welcoming the members. Also, I explained the rules about confidentiality, and I asked the members to introduce themselves, and I used a round for this exercise. In the middle phase, you will see an exercise to let the members explain their expectations about the group, and I also explain my role and the purpose of the group. And you will see also a section where I shift the focus because I noticed the members were very stressed about what was going to happen with them, and they needed information regarding the program rather than the information of the therapy. So I decided to provide information regarding the program, and also I decided to teach a breathing exercise to help them to calm down. And the last phase will include summarizing. And also I asked the members to have a little homework regarding the breathing exercise that they'll learn. And we close the session. Hopefully you'll see the skills that I used are use of voice, use of eyes, tone setting, information giving and mini lecturing, and also cutting off and drawing out, and shifting the focus and deepening the focus. Thank you.
Hi everyone, my name is Janet Moreno Payne, and I am a social worker here at TLP, and I'm going to be your group worker for the next 12 sessions. So first of all, I would like to welcome you all to the program, and I want to welcome you all for being accepted into the program. I know that it's a long waiting list, and I'm very glad to have you all here. Okay? And before we start with the session, I would like to explain a little bit about what is confidentiality. Confidentiality means that everything you say here stayed here, but unless I hear that somebody is going to be hurt, or you're going to hurt yourself or somebody else, I will have to report that. Okay? Besides that, I want you to see this place like a safe place to share. And we're going to be working for 12 sessions. We're going to be meeting here every Tuesday at the same time. And we're going to be having approximately 1 hour and a half. Okay? So, I already tell you my name, and you can call me Janet, Miss Moreno, Miss Payne. Don't call me bad names, okay? Yeah? So, I would like to take 2 minutes to know your names and to know your age and how long you've been out of foster care. So we're going to do a little round, and we're going to start here on my right to see. Okay?
Hi everybody, my name is Monica, and I just turned 19, and I was at a foster home since I was born, and I'm glad I'm here.
Okay, thank you for sharing. And how long have you been out of foster care?
Well, I've been out for about 6 months.
Thank you for sharing.
Let's see. My name is Trisha, and I've been in foster care. I'm 19 also. I've been on foster care for a while now. but I just been living on the streets. So I'm glad to be in this program.
Thank you for sharing.
My name's Erica. I'm 20 years old. I was living with my grandma since I aged out. But we've been getting in a lot of trouble because my mom.
We'll address that later, but thank you so much for sharing. And how long you been out of foster care?
2 years.
Okay. Thank you for sharing. And
My name is Jacqueline Gessen. I'm 18 and a half. I've been in foster care since I was in middle school.
Toward your lesbian?
Yes,
Thank you for asking, Monica. And
I'm proudly a lesbian.
I have a lot of friends that are lesbians too.
So
that's a great point. And you know what? Later in the sessions, we can share those experiences, and I think they're going to be very helpful. Okay. Thank you. Thank you for sharing. So again, thank you all for sharing. I'm very excited to have you all here because we're going to do a lot of stuff that is going to help you. As you know, Transitional Living Center, and this is a group therapy for people who is dealing with PTSD. So we're going to be learning what is PTSD, what are the signs, what are the symptoms. We're going to be learning how to address those symptoms, those triggers. So hopefully by the end of the program, you're going to be able to deal with certain feelings and to deal with triggers or memories or intrusive thoughts. Okay? And before I continue with the session, I would like to hear what are your expectations of this group. Okay? So I'm going to ask you to do a little activity. We're going to do diets. We're going to pair up. And I want you to share with your partner what are your expectations of this group. What are you expecting? And also I want you to tell your partner what is the last thing you expect, what things you don't want to see in the group. Okay? So I'm going to give you like 5 minutes to do this activity. And I'm going to ask Erica and Trisha to work in pairs, and Jackie and Monica to do it, okay?
Okay.
And you can stand up or get together, and then we'll go back to us.
Hi, Monica.
What do you I expect.
Okay, ladies, thank you so much. Let's go back to our seats, and then let's hear what are our expectations. Okay? So let's start with my.
I expect to, for people to like me, for me, for who I am, and to where I can trust people.
Thank you for sharing.
I expect to learn how to live on my own pretty much because like I said, I've been out of foster care for 2 years. So I want to learn, how to pay the bills and how to live on my own without getting kicked out of my own apartment.
Thank you for sharing.
I expect to learn how to work with or deal with, or I don't know the word, the triggers that are associated right now with me, like that sets me off. I want to learn how to work with that, how to deal with that.
Okay, thank you for sharing.
I expect to put my past behind me and start a new life where I can learn some new skills and be self-sufficient and independent.
Okay, thank you for sharing. So what I'm hearing is that you're looking forward to the future, which is great. But also what I'm hearing is like you have to deal with some stuff that have happened in the past. So that's the reason we're going to be doing a CBT therapy here, which is a cognitive behavioral therapy. We're going to be working with certain events that happened in the past, and then we're going to identify those feelings and hopefully knowing how to deal with those feelings and how to replace these negative feelings with positive feelings. How that sounds to you?
Sounds good.
Okay. And let me explain a little my role to you. So I'm going to be the person who's going to be facilitating this group. and I'm gonna be sure that this is a safe place to you, and we're gonna be having a respectful way to share our emotions, our feelings, and also I'm gonna be providing you a lot of psychoeducation regarding PTSD, signs, symptoms, and triggers, and also therapy. So that's how we're gonna be working here, okay? And I noticed that all of you were screened to be on this group. So I know it's a lot of stuff going on in your lives. I know that you're being like having a lot of new processes, new people, and I would like to check in with you to see how you're doing today. Okay? So I would like to know from the scale to 1 to 10, how you're feeling today. Like 1 meaning like I'm not stressed at all. 10 meaning that I'm really, really stressed. Okay? So let's start now with Erica.
I'm at a 9 because, like I said, I've been kicked out of the house, so I have nowhere to live. And I've been feeling a lot of stress because, I mean, I don't even know where I'm going to sleep tonight. And that's why I feel like
Thanks for sharing.
I think I'm at a 7. I too, don't have anything as stressed out as Erica, but I can understand why she's stressed out. So I would say a 7. I'm a quick 7.
Okay.
Well, I would be at 10 because the same, I don't have anywhere to go. I have friends, but I can't go live with them. They don't want to deal with me. I don't want to go and be a burden. So at 10.
Thanks for sharing. And Jackie?
I'm gonna follow mine.
So what I'm hearing is like our levels of stress are kind of high. So I want to address this, that this is normal because you are experiencing a lot of stuff. You have a lot of changes, and as being part of this program, we can connect you with a caseworker that is going to find a place for you to stay. So sometimes we have place here in the facility, but sometimes they will refer people to other place. So we can work with that, and we can work to find you a place.
When you say find us a place, you mean temporary? How long? Like, I have food. I don't want to be coming
Is
down
it
the
going to
day.
be with
Yeah.
foster parents again?
No, those are great questions because you're going to be attending a session where they're going to be addressing all these services. But being part of this program allows you to stay up to 2 years, and you're going to be provided with services, with a lot of classes. So that's the reason I'm very glad to have you all here, because that means that you have this opportunity. So you're going to be part of the program, you're going to be attending this group, and hopefully you're going to gain all the skills and you're going to learn how to cope, how to be productive outside.
I don't want to go back to foster parents. I don't.
Okay,
If I did place me in foster parents, I'm going to run away.
No, well, you already aged out of the system, so you are, this is an independent living system. So you're going to be living here in the facility, or you're going to a place where it's going to be subsidized. So you're going to be maybe sharing the apartment with another person that is in the same situation as you. Okay. So does somebody else have any questions? Or
I have another question.
yes.
Will that program? Will that part of the program start today? Like, am I gonna have a place to stay tonight?
Maybe, yes. I will refer you because I didn't know that you were in that situation. But I'll refer you to the caseworker and they may find a place for you. Okay?
Will they take lesbians?
Sure. No, it's no problem. Your preference is no problem for the program. Okay? So I wanted to address and reassure you that you are in a safe place. And the goals for this group is to learn how to cope and how to deal with, my understanding is that you may experience some traumatic events in the past. And over time, gradually, we're going to be addressing those experiences and we're going to be learning how to deal with them. Okay? So, I would like to teach you a little exercise that is going to help you to address those levels of stress. So I would like you to put your hands, one in your chest and one in your stomach. And I want you to inhale, like deep, until you feel the air going through your stomach. And then you exhale slowly. This will help you to minimize those levels of stress. And this will help you to control those negative or disruptive memories. Okay? And what I would like you to do is, during the week, when you feel like stress or you have intrusive memories or you're like afraid, I want you to practice this. And then I'd like you to monitor if this is working for you. And next week, you're going to tell me. You're going to let me know, you know what, this worked, this didn't work. And over time, we're going to be having other activities that will allow you to work with your stress. Okay? How does that sound to you? Okay? Does anybody have any questions about what we're going to be doing here?
Are they going to feed us?
That's a very good question. Yes, it's part of the program. So, being in the program means that these issues that you were worrying about it, as where you're going to stay, where you're going to live, where you're going to eat, this is going to be taken care of for the program.
How about clothes? Because I don't have any clothes.
We can check with the case manager. Oh, that's very good.
Do you have a lot of clothes?
Yeah. You can borrow
Yeah.
some.
After the session is over, we can see if somebody else has the same issues. And also we have a case manager that she can help you with all that kind of information and services. And I'll give you her information, and then you can contact her. If for some reason you don't have any response or anything like that, you can bring the questions to the group next session, and we'll try to address them. Okay. What we did today, we went over what we're gonna do over the next sessions.
I can give her some of my clothes.
Yeah, we're gonna address that.
So am I gonna have to worry anymore where I'm gonna be staying?
No, for the next, you are accepted into the program, so you can stay up to 2 years. So,
How do I guarantee that I can stay for the next 2 years?
Yeah, I think a guarantee is very important.
yeah, and those are really great questions. I really appreciate you have them. But you're gonna have your caseworker that you can address all this, and they're gonna explain to you rules and how is all this program working. So of course there are gonna be rules that you have to follow. It's gonna be requirements that they're gonna ask you to do, and of course it's gonna be a little bit overwhelming and stressful. So that's the reason I wanted to have this technique. To whenever you feel this, you use it. And you're gonna be doing meeting a lot of new people, addressing new experiences. So it's gonna be a little bit like overwhelming.
Do they let people smoke here?
Here in the facility, no.
Okay, good, because I have asthma and I don't like smoking.
Okay, no, that's fine. Thank you for sharing. Jackie, I noticed that you are having a little feelings right now. So would you like to share with us?
No, I'm just so stressed.
Okay. So you think you can work with this technique over the week and tell me next week how it goes?
Yes.
Yes? Okay. Now we are finishing our session, which I think it went pretty quick. I don't know about you ladies, what do you think? We went over how we're going to be working. We explained the rules of confidentiality, how you guys have to respect each other, and also you have a little homework to do. Okay, so next session, next Tuesday, when we come back, I'm going to be following up with you to see how you do with this technique, how you're feeling, and we're going to be learning what are the signs, the symptoms of PTSD. Okay, thank you so much for coming, and I'll see you next week.
Thank you.
Thank you.